Editor-in-Chief of DevX, back for another conversation as we all try to figure out what's happening during this pandemic crisis. And I've been talking to leaders of all kinds, people who have a great expertise and perspective on this. And I'm really excited today to speak to my own colleague, Jenny Lei Ravelo, who's a senior reporter at DevX. You know her byline, her work very well. She covers global health. And you and I are in different parts of the world. I live in the United States, you live in the Philippines. We don't get to see each other too much. So this is really fun for me to get a chance to connect and just talk about this. And we thought, rather than just do it ourselves, let's make it live and let everybody listen in. And I really do want to hear your take on this, Jenny. You've been following this really closely. So maybe just to start, since you're based in Manila, what's the situation like in Metro Manila? A major city, maybe typical kind of mega city that a lot of people have been concerned about when it comes to this pandemic. And in a country like the Philippines, how do you see the situation today where you sit, and how's it playing out?
Okay, so when I guess I can start by saying we're still on lockdown, very much in the capital,
Yeah.
and I've been home for more than a month now, going out for just basic necessities. The lockdown is extended until mid-May, so around May 15. And there's been talks in the government of easing the restrictions in some places where cases have not been really high. But that's not the case in the capital, where this is the center of the outbreak. But some of the challenges in the I guess around February, March, about testing. There's now an increased testing capacity, although the government has not yet reached its goal of testing 8,000 cases a day. I know that's very, very low compared to other countries, but I think that's the goal of the government, and they've not reached that yet. We've seen that I think the cases are now over 8,000 cases. But then the recoveries versus the deaths are now higher. I think the recoveries are now over 1,000 and deaths are over 500. So I think that's a good sign.
Yep,
There's
it is.
Yep. So we're still following this through. Hospitals are still overwhelmed. And I, every day I'm talking to some friends who are doctors and nurses, and you see how they are disheartened, but in some hospitals they have to they can't accept patients who may have some emergencies, patients
Because they're
may
so dedicated to the
suffer.
COVID response.
Yes,
If you come in with a heart attack or something, you
heart
just
attack,
can't
yeah.
proceed.
So
Yeah, I
that's
mean,
one
this
thing
is
that
one.
I'm really concerned, because I know people who have chronic diseases who have to go through the hospital and they can't. Also because of the shutdown of public transportation. So there's a lot to consider, especially as well in the economic repercussions, and also people who want to go out and go back to their jobs, because they're the hunger rate, the food security is a real problem.
Yeah, let's talk a little bit about that, because this idea of social distancing, it's tough, even in many advanced economies. But there's a larger percentage of white collar workers. People have a little more savings. They can do some of their work from home. They can get delivery services. I've spent a lot of time in Metro Manila, and I'm just trying to imagine what that city is like right now under lockdown. I mean, it is a packed, dense metropolis. Traffic is like the number one thing in Manila. You've got to plan hours to get. Are the streets empty now? I mean, is the lockdown really working in that sense? Can it work in that sense where people really just aren't out? Public transport isn't moving. Jeepneys are stopped. I mean, how does it look?
Well, if you look at EDSA, which is the main the main road going to our office in
It's a
Ortigas,
huge highway. It's, what, 6 lanes or something on each side, right? It's huge.
it's empty. It's empty at the moment. Of course, you'll see a few cars, a few cars for those who are going to hospitals, medical workers, essential workers, or those who are going for a grocery run. But we have checkpoints. So each city has a checkpoint. And so even if I'm living in Quezon City, and if I want to go to our office in Ortigas, I have to go through a checkpoint. And if I don't have a special pass for media, I wouldn't be able to go through. And there's a lot of police and military scattered all over. There's now more restrictions on the number of people who can go out from each household. So you really have to have this quarantine pass that the local government units are giving out, and you have to bring your IDs. Well, it depends on how strict the government units are, but you have
Hmm.
to bring your IDs for them to be able to confirm that it's you who've actually gotten your you've gotten a permission to go out. There have
So
been
the
cases of people really being taken by police because they're they're not following the restrictions in place.
So in many ways, it sounds like the lockdown is working. I guess I wonder, now it's been extended to the mid-May. Many other countries have similar circumstances of lockdowns that are announced and then keep getting extended. I've been talking to a lot of epidemiologists about this, and it seems like everybody consistently says this is a long-term battle. This is not going to kind of just go away. How do you see it playing out in a place like the Philippines? How do you see this developing there?
um it's a concern. I mean, of course you've got to factor in the economic impact. Of course, as much as possible you'd want to get things back to normal, but then yes, in a place such as Metro Manila, it's so hard to lift the restrictions because you know how many people are just going to go out there, and social distancing is, there's no social distancing that's going to happen if that happens at all. If you go, we don't have a good public transportation here. And so just imagine if the buses and the trains and are back on the streets, and people are back to go to work. That's a nightmare, and will probably have an increased number of cases if that happens.
Right, it's such a tough call because you either have to start things back up so people can go out and work and eat. I mean, such a high percentage, I don't know the exact number, but I'm guessing it's well over half of the population of the Philippines works in the informal sector. And so they're probably getting paid daily or weekly from labor, and if they're not out, they don't eat. So you kind of have to get out and about. But on the other hand, if you do that and you're not down to 0 cases, there's no vaccine, it can explode pretty quickly, as this seems to be such a highly contagious disease. I wonder if you just extrapolate that out from the Philippines. You're based there, but you cover for DevEx these global health issues in many parts of the world. How do you see this? Is the situation sort of similar in Africa, in the rest of Southeast Asia? What are some of the things you're hearing from your sources about how this might develop?
Well, experts are, and even WHO has actually been saying, let's be very careful in easing restrictions, and easing some of these restrictions, because um, you know it's tough. We don't know. We're gonna see a high rates of cases if we just decide, okay, the lockdown is lifted because the number of cases have started to go down. We're good. No, it's not gonna happen. You've seen, I think, for instance, Singapore. So Singapore is a good case study because they've actually for quite some time they've not imposed a lockdown, similar to some of their neighbors. They've done this, but they were very effective in implementing social distancing in much of their public places. But now there's a part of their population, the migrant population, that have been, I guess, overlooked in testing. And so now there's an increase in cases in Singapore, and 90% of the cases in Singapore are in migrant workers. So you see that, now Singapore is on circuit breaker. They're not calling it lockdown, but there's now a little bit more restriction in place. Um, I think in Japan now, they've also not done a hard lockdown, but they're now on state of emergency because I think some of the restrictions in movement have been lifted, and now there's a spike in cases in Japan. So
Yeah,
so
Japan
you
was doing remarkably well for a while.
for a
Part of me has
while.
to believe it's that masks are so ubiquitous there, and it
I
was
know, I
easy
know.
to get everybody to start entirely wearing masks, which now it seems like, according to guidance from health officials, can make a difference, especially when it's done at a population level. Obviously, a lot harder to do in the Western world where the masks weren't there. and the guidance was different for quite a long time.
Yeah, but I think in Japan they've not really imposed like hard policies. They've not say, okay, we're gonna shut businesses, we're gonna shut down bars. They've not done that. So what happens is, I think the mayors are speaking to businesses, requesting them of some sort, and not really something similar to the Philippines where the national government has intervened and said, okay, this is what's going to happen in the capital. We've seen cases, for instance, in Iran. So Iran, there's been a really high number of cases in Iran, and so there have been imposed a lot of restrictions. Now they've eased out on those restrictions, but I've been getting reports that there's now a concern that the cases are increasing and hospitals are being overwhelmed again after some of these economic restrictions are lifted.
Yeah, let's talk about healthcare workers for a second. Here in the U.S., which is heavily affected, and in the U.K. and Spain, healthcare workers are being kind of hailed as heroes. In Italy and elsewhere, where you've had major outbreaks,
Mhm.
and they really are. I mean, they've been working through some of the toughest conditions, putting themselves at risk to do it. We at Devex have been reporting a lot for long before this pandemic about the healthcare workforce gap. This idea that, especially in low and middle income countries, there's just a huge gap in nurses and doctors. Philippines, obviously a famous place for this. You educate a lot of the nurse and doctor workforce for the world that comes from the Philippines. But I guess I wonder what you're hearing from healthcare workers directly about the situation. What is it like to be a healthcare worker in some of these less resourced countries and locations that are maybe starting to get hit, could get hit a lot worse in the coming months?
Well, one of the things, let me just take that for example in the Philippines because because of the proximity. But one of the things that they've been calling for is really more protective equipment. There's a really huge lack, and I know in places such as the U.S. and even Europe, this is a problem. But um, but but this is I guess even those country, your country, US and Europe have even more access to to these types of equipment. Here in the Philippines, that's one of the calls. And so one silver lining in that is that a lot of individuals, local businesses have stepped up and they've started to innovate, and really they're the ones, when the government was having challenges in procuring this equipment, they're the ones who've stepped up and actually provided them trying out DIY stuff to provide to healthcare workers. When the lockdown happened, one of the biggest issues is that of course healthcare workers still need to go to work because they're the essential workers that's needed in this pandemic. But there are no transportation, and that kind of policy was not thought out comprehensively. So on the first day of the lockdown, you've seen nurses or even doctors walking for hours just to
Wow.
get to the hospital. So it's crazy, and I guess in some of these places there's also this there I mean, it's the way I look at it sometimes is Ebola on a larger scale now. It's a pandemic because there have been cases where patients uh, don't tell their doctors their travel history. And so there have been cases where an entire unit in a hospital have been infected because they didn't know that one of their patients was infected.
And this is
Yeah,
because patients are scared of the stigma. They know,
they're
okay,
scared.
if I came back
Yeah.
from this country, Northern Italy or something, people are going to assume it's the worst. And yeah, that's a very dangerous thing. The stigma issue, especially where testing capacity isn't ubiquitous and strong. Um, you can see that absolutely happen. Let's get into a couple other things, because I've been reading your reporting on TB and malaria. You mentioned Ebola, and during the Ebola crisis in West Africa, 6-7 years ago now, the more people died from everything besides Ebola, right? I think
Yeah.
11,000 people tragically died from the disease itself, but then you had many more, multiples of that, dying of things like pediatric malaria because they couldn't get access to hospitals and clinics, or they were scared to go in. You talked earlier about people who, with heart attacks being worried about going in for care. What does this mean now for the diseases that are so prevalent, that are the biggest killers in the developing countries in the global south, like TB, the world's #1 infectious disease killer? I think 1.7 million people die a year from it, and malaria, which still kills hundreds of thousands of people. And what does it mean for the efforts to eradicate or diminish the death from those diseases?
That's one of the biggest concern now, from the health community, and everyone's just trying to see how they're going to be able to operate in these very tough times. Um, but but just look at, you've mentioned TB, malaria. I know we've done, Will has reported on polio, for instance. That's really concerning. We have an active outbreak of polio in Niger at the moment, and how
Yeah,
are
that
they
was
going
just
to?
announced, I think, last night by the WHO, right? There's
Yeah,
a,
this was, I think it was Sunday.
yeah,
Yeah, but just very recently. And so that's really concerning on how you're going to be able to do that. And I think I remember, with GPI, saying that if we can resume, operations around June or July, but then how likely will that happen, given that we can't even see the end of this pandemic?
yeah. And that's the
I know.
global polio eradication initiative you're
Yes,
referring to,
global.
that
Sorry, yeah.
coordinates all those global campaigns to vaccinate children.
Yes, and immunization is a real worry now. Everyone's just focused on COVID. Even with TB, a lot of the TB tools, for instance, the gene expert systems, are being used for COVID now. Um, but then you see TB cases. There's a dwindling number of TB cases, because case notifications have gone down. The active tracing of TB is not going as it used to be, and even staff, hospital staff that's used to work on TB have now pivoted to COVID. So now there's a lot of, I think it's, the way I would describe it, as a public health nightmare, really, because what happens if we got over this pandemic, but then you look back on all of these health issues, and what we're back to, all of the gains that we've made, over the last few decades.
And they can go away quickly, right? I mean, that's why the investments in systems are so important. That's what a lot of the public health experts talk about, because if the systems are there, you can come back to those. But the reality is, if you see caseloads of infectious diseases grow, it becomes that much harder to bring the numbers down. There's real concern about diseases like measles getting out of hand.
Even in DRC, right? I mean, even before this pandemic, with the Ebola outbreak, there have been concerns about there are more children dying from measles than the Ebola.
Yeah, that's right. And so obviously, when it's a pandemic, one of the different factors is that it becomes a global issue. And so the rich countries and the poor countries, the dynamic that already exists, right, where there's different priorities and there's politics, those dynamics get heightened. And so I think a lot of the arguments being made in places like the U.S. Capitol or the British Parliament are, well, look, if we don't invest in these health systems over there, it's going to come back and bite us. This is a pandemic. If you have disease outbreak in any part of the world, you can't open up the whole world. You're going to stay with sort of a global lockdown. And so we're appealing to those kind of economic and security arguments, when this is also a massive humanitarian challenge at the same time. I guess I'd love to get your take a little bit about an organization you cover a lot, which is WHO, because that has obviously gotten caught in this political crossfire. Kind of lay out for us how you see the situation there today.
Oh, so for WHO, I know it's tough. I suppose for the organization. I mean, the the COVID-19 pandemic is not the only crisis it's dealing with, right? I mean, the ongoing Ebola outbreak is still there. They still have staff, doing contact tracing in there. There are other, health crises out there that the organization is dealing with and coordinating. It has a very small budget. And I remember I was speaking to the, one of the ADGs, just before they were supposed to announce, the outbreak of Ebola over. So I was speaking to him, I think three days before that, and then a couple of just the following day after, they found a new case of Ebola in DRC. So and when I was speaking to him, he was telling me that since December, they've not received funding for Ebola. So and so now they're using what money they have. And I know there's been a lot of funds that have uh, been put in place. We have the Solidarity Response Fund. But still, this is a global pandemic and it requires huge resources. Um, and in the midst of that, WHO, as you mentioned, is caught in this political crossfire. Um, and I can just imagine the, the impact on the morale of WHO staff at the moment. I've not had wide conversations with staff so far, but some of the discussions I've had, there's a feeling that the organization has not been able to, yeah, in a way, defend its reputation, its image in this
I mean, it
situation.
can't, right? It can't talk back because this is their largest donor by far is the United States government. As you say, their overall budget is pretty small. They have, I forget how many member states, 150,
190, yeah.
190 member states,
90,
right? They have to,
yeah.
the board meetings that Dr. Tedros has to preside over must be unreal. And I've spoken with him about this in the past. You have to get everybody to agree. It's sort of a consensus-led operation. And in the end, you need countries to want the WHO and allow the WHO in and listen to its guidance. So for a consensus-driven organization like that to face its number one donor by far, going on a direct attack and halting funding and making it very personal and very political, boy, that's hard. There is no way to really defend yourself if you're the WHO in that circumstance, right?
Yep, and also not just the U.S. I mean, I think Australian government now has called also for an independent review, and I think increasingly of the experts I've spoken to, that's really their call to do an independent review. But there are differences in opinion in terms of when that review should take place. I mean, I was speaking to a Professor David Fiedler from the Council of Foreign Relations, and one of their calls is really for the UN Secretary General to come in and lead a call for an interim review. So right now, because the reputation of WHO is also, there's a lot of, how do you trust the WHO in the midst of all these accusations? And so that's what their call is. But there are others are calling right after this pandemic. Let's focus on getting this under control, and then we can do that review afterwards.
Right, and especially at a moment when there's so much misinformation out there and active disinformation, and people need to know, where can I trust? Who do I go to for trusted information? And in some places that might be clearer than in others. But boy, not having the WHO seen as a clear kind of gold standard institution that can tell you the normative, information about what is real and what isn't. There's a lot of risk in that for the world, especially for a pandemic that's not going to be over in 2 months, from what everyone is saying, right?
Yeah.
This is going to go on for a long, long time. So
yes,
we need our institutions to be in place. And in these investigations, who knows what it will find? I'm sure there will be things that are found that could be improved. A lot of the attacks that are made on WHO now are things like the travel budget is too high, and there's probably a lot of truth to that. But the question is, what is our priority right now? Do we want to attack their travel budget, which may be egregious and wrong and needs to be addressed in the future, but when there's a pandemic taking place?
I think some of the issues that are thrown at WHO are repetitive. This travel issue, it actually happens every time the World Health Assembly is nearing. So it's interesting to see, to hear again these issues come up. The issue of Taiwan, for instance, I know it's propped up right now, and also because of the pandemic. I know everyone's looking at Taiwan, and some of the experts are saying this is, I guess, Taiwan is using it as an opportunity to put its case out of the importance of being a member of WHO. But these are geopolitics that WHO can answer, and it's only, I think some of the experts I've spoken to are saying you need the member states to stand up and say, to admit, for example, Taiwan into the World Health Organization. It's not something that the World Health Organization can just answer. It's an organization that's answerable, reporting, and accountable to its
Right.
member states. Right? It's they're the ones approving its budget. The WHO during the World Health Assembly and executive board meetings, they're reporting to their member states, and the member states are providing feedback on what they don't like, and what they'd like for the WHO to do.
Yeah, they're in an impossible position, it seems like. And as you say, their budget's not that big. In the end, they're bigger than a international NGO, but not by much. They're about the size of an international NGO, any of the big brand name ones that we all know. And this is the name. When you hear WHO, you assume this is a much larger institution with much more capability than actually what it has today. So to cut its budget now, or to stall funding, I understand that maybe there's no immediate cash difference for the organization because this is a kind of scheduled money that would come later, but still, it sends a signal, and it's got to be demoralizing for staff there that are in the midst of, as you say, multiple crises, not just COVID.
Absolutely.
Yeah. Look, we're running up on time, but I guess I wonder, Jenny, what are some of the issues you're looking forward to digging into more as a journalist now, as this story develops?
So we're following through. Of course, we're following discussions on vaccines and treatments. To date, there's 7 vaccines in phase 1 clinical trial, 1 vaccine in phase 2. We're still really, really far ahead from having one, but of course, everyone's hoping that we'll have it sooner than later. There's now solidarity trials, the one that WHO is leading. Over 100 countries have expressed interest, although there's still a few countries where this is underway, and it has got a lot to do with I guess regulatory approvals in countries, or how many cases do they have to be able to enroll in those trials. Um, One of the things that Sarah and Lisa are actually looking at is data. So data discrepancies. Where, as you know, we have this internal document where we update cases globally, where we look at the numbers, the changes in case numbers every day. We're seeing some discrepancies in reporting, because we're not just looking at the WHO numbers. We're also looking at, for instance, the Johns Hopkins. We're also looking at other sources of information, and we're seeing some discrepancies in reporting. And so that's what we're looking at right now, and see how problematic is that, especially, for instance, for researchers who are trying to analyze the situation.
Well, you see, you have a lot of cases where people might have died and we don't know what it was from, but you can see, you can maybe realistically attribute it to, to the broader COVID crisis, because these are cases that normally wouldn't have existed. It looks like the death rate has gone up in certain places. So getting those numbers right is really important. And I would recommend that timeline to anyone who hasn't seen it. It's actually, something you've been working a lot on. And if you Google COVID timeline, it's one of the top hits, and for good reason, because it's really one of those few timelines that takes you through, especially a global development, a global health lens on what has happened during the course of this crisis. And so, it's become a real resource for very many people around the world. And I think it's a great initiative that you've led and you put out there, Jenny. Thanks for doing that, and thanks for all the reporting that you and your colleagues are doing. We at DevX are working hard at this, as I hope you can all see out there who are watching this conversation. And we're very invested in it as an organization. Our journalists are all over the world and are on top of this as best we can, trying to figure out how to do this from home, and under lockdown in many cases, like where you are, Jenny. And so we appreciate all the support, all the well wishes we've been getting. And for all of you who subscribe to our newsletters, who subscribe to our social media channels, and especially want to shout out those of you who have been subscribing to our Pro subscription, which is our paid subscription for news. If you want to see everything Jenny writes, everything that our incredible journalists and analysts here at DevX produce, that's something I very much recommend to you. And it's been amazing to see how people have been stepping up to do that, to support our work at DevX. So please keep that up. And we really appreciate it. And reach out to Jenny on Twitter and social media, and to myself as well. We want to keep this conversation going. So best wishes to you, Jenny. Good luck out there. we'll be in touch.
Thank you, Raj, and have a good day.